Hi-ho, health seekers, Dr. Ambs here. And as a physician working at a large level 1 trauma center, I've seen the devastation of dementia firsthand thousands of times. Imagine losing pieces of yourself, your memories, your relationships, your independence, all slipping away without warning. Dementia affects millions of Americans, but there are things you can do today to help keep your mind strong and healthy into the future. In this video, I'm going to break down the science behind dementia and reveal proven strategies to keep your brain healthy and resilient. So stick around because the changes you make today could be the key to preserving your mind tomorrow. Let's talk about dementia in America. It's estimated that more than 6 million people, or almost 2% of the population, are affected by dementia. The most prevalent form of dementia is Alzheimer's disease, comprising 60 to 80% of all cases. Now, in medical school, we were taught that amyloid plaques were the primary pathology causing Alzheimer's disease. Unfortunately, therapies targeted at reducing these plaques have repeatedly been ineffective in treating dementia. So we're still a little confused as to the exact cause of dementia, but many scientists are now thinking it could be driven by metabolic factors. So we'll take a deep dive into that later. Vascular dementia is more easily understood, as the blockages of arteries in the brain lead to downstream dysfunction and even death of nervous tissue, as they are not getting enough blood and oxygen supply. There's other forms: frontotemporal dementia, Lewy body dementia, and mixed dementia. Now, one thing I want to talk about that does not get enough attention is something called mild cognitive impairment, or pre-dementia. And it's estimated that there's another 6 million or more cases of this, or another 2% of the population. So when you look at all these forms of dementia together, you're talking about maybe more than 12 million cases and up to 4 or 5% of the population. Now, this is huge. It's so prevalent, in fact, that many people believe that both our sitting president and our president-elect suffer from some form of dementia. So to get a clearer look on this, I invited my cousin on, who's a political commentator on X.
Howdy y'all, Buck Cooter Jr. here. I'm a political commentator on X, formerly known as Twitter. Become pretty famous in the past few months, known for my unbiased takes on political issues. So famous, in fact, that I've been retweeted by Elon himself many times. Chris, I believe your question is either Joe Biden or Donald J. Trump suffering from dementia? And let me make it pretty clear for you. Joe Biden is squirrelier than an oak tree in acorn season. I don't believe I could put it any plainer than that. And Donald J. Trump, he's as sharp as a tack. Let me assure you, he's got a mind like a steel dossier. Steel trap. I'm disappointed, Chris. I thought you were making quality educational content. What are you doing bringing our right-wing cousin on the show? He's a lunatic, man. And Biden is not demented, okay? His age and his wisdom are his superpower. Besides, Queen Kamala would have reigned supreme if it wasn't for white trash like Bucky Cooter Jr. Hell, boy, if you believe that, you must be hiding a squirrel up at the top of a bald cypress tree. Let's just go to the tape.
Eligible for what I've been able to do with the with the COVID. With dealing with everything we have to do with. Look, if we finally beat Medicare.
That's a totally cogent thought, man. Medicare has been oppressing us for years, and Biden's a hero for finally striking it down. Yeah, I might stumble over his words every now and again, but his mind is strong on the inside. Most importantly, he's kind, man. Trump is a deranged lunatic. Check this clip out.
I don't know what I said. I don't remember.
Enough, guys. We're not going to politicize dementia. And while we might not understand the exact mechanism of what causes dementia in some patients, understanding the risk factors gives us clues and informs us on how we can modify our behaviors to keep our brains healthy. As you can see here, it's a lot of the usual suspects that are responsible for poor health in general. One thing I really want to highlight is insulin resistance, and I worked really hard on the next segment explaining how insulin resistance could be causing dementia. Another thing to take note of, in the health community, we refer to those last 3 risk factors as the white trash trinity.
Well, goddamn, cousin, I take great umbrage to that statement. Hell, my pappy never got out of 3rd grade. He drinks 6 bourbons a day, smokes 2 packs, and his mind is sharper than a squirrel's nail after he's been climbing up and down a pine tree all day. Besides, he just passed the biggest multiple choice test of all time after he bubbled in Donald J. Trump.
Au contraire, cousin. Voting Trump proves that Pappy's demented.
Unless he thinks a deranged fascist dictator is good for the country. Oh, and Chris, I'm asking for a friend. Smoking weed's not a risk factor, right?
Cheerio, Dr. Nigel Foggy-Bottom here. My poor sweet brother attempted to make the segment on insulin resistance, but I'm not going to lie, it was a bloody nightmare, it was. But to be fair, I don't think they teach the hormonal regulation of nervous tissue in Caribbean medical schools. Let's just say he's decided to leave the more sophisticated research segments to me. A new interesting phenomena is emerging in the research literature, and that is showing that insulin resistance and diabetes plays a key role in the development of dementia. So much so, in fact, that many are calling Alzheimer's dementia type 3 diabetes. I took a deep dive into what we currently know about this subject. Let's explore, shall we?
Neuroimaging studies show that insulin resistance affects brain regions such as the medial temporal lobe, hippocampus, prefrontal lobe, and cingulate cortex, which are critical for cognitive processes. Insulin resistance in the brain is linked to impaired insulin signaling pathways, particularly in the hippocampus and prefrontal cortex, which are crucial for memory and executive functions. Insulin resistance promotes neuronal apoptosis and synaptic dysfunction, leading to cognitive deficits and memory impairment. And finally, mitochondrial abnormalities, including reduced ATP production and increased reactive oxygen species, are prevalent in insulin-resistant conditions.
So what can we do, not just to avoid dementia, but to ensure that we're operating at full cognitive capacity for the rest of our lives? At this point, you're probably sick of taking advice from someone with multiple personality disorder. So let's hear from Dr. Peter Attia. He's a brilliant physician and author of the popular book Outlive. His focus is on medicine 3.0, delaying and maybe eliminating the onset of chronic diseases such as dementia. Not only that, he has a research team that always stays on the cutting edge of the latest literature. Not to mention, he's a total dreamboat.
Unequivocally true things for brain health are sleep matters. Another unequivocally true thing for brain health is that lower LDL cholesterol and ApoB is better than higher. Another thing that is unequivocally true is not having type 2 diabetes matters. And the fourth one that is unequivocally clear is exercise matters.
Thank you, Peter. You're the best. Now for a more exhaustive list of all the things you can do, not just to maintain your brain health, but even improve your cognition over time. Now, a lot of these are the usual suspects that we talk about on this channel often, but I want to highlight biomarkers. There's some blood tests that your physician is probably not ordering that are crucial in understanding your general health and your risk for dementia going forward. So stick around for that.
Hell, cousin, that ain't no exhaustive list. You left off two of the most important things: squirrel shooting and worshiping our Lord and Savior Jesus Christ. I actually agree with Bucky Cooter on this one. I thought this was going to be an exhaustive list. What about Tai Chi? What about tofu? Or is it just that your big pharma buddies can't profit off ancient Eastern wisdom?
I'm glad you guys can finally agree on something. And you're actually both correct. Both positive thinking and stress management are correlated with lower incidences of dementia, which brings me to our next sponsor.
Staying positive in this world can be so challenging. Everything's so messed up. And people are actually voting Trump. How could they actually vote Trump? Let's face it, sometimes we need a little help to be positive. Try Haputol. Hell, try a whole handful. Forget about your problems and say fuck it all with Haputol. Brought to you by Big Pharma. Side effects may include mania, depression, suicidal ideation, suicide, homicidal tendencies, and voting Trump.
Let's talk about the specific biomarkers we should all be getting checked to make sure our risk of dementia is as low as possible. First off, hemoglobin A1C. This takes your average blood sugar over the past 3 months. If your level is 5.0 or less, you're doing great. If it's 5.7 or higher, you have pre-diabetes and definitely some degree of insulin resistance. Once you get to 6.5 or higher, that's full-blown diabetes. You should get this checked every year to make sure you're on track. Next, let's talk about your lipid panel. LDL and triglycerides are classically considered bad cholesterol, and you want them to be low. HDL, good cholesterol, it should be high. Now, ApoB is a protein that sits on bad cholesterol, and it's emerging as a very important biomarker for cardiovascular risk. Your doctor will not check this unless you specifically ask. So definitely get that checked. It's very important. Now we want to look at vitamin D. Vitamin D deficiency is very common and it correlates with higher incidence of dementia. This is something that you can easily check and correct with supplementation to make sure your risk of dementia is as low as possible. Next are homocysteine and CRP. These are markers of inflammation, and you can get them checked to make sure that you don't have any inflammatory process or possible metabolic dysfunction underlying. Now, it can be harder to chase down the exact cause if these numbers are abnormal, so just keep in mind when you're getting those checked, you could be put into a gray zone if they are elevated. Next, my brother Nigel, he made some videos on ApoB and hemoglobin A1C, and they're actually pretty interesting. I hate to admit it, so check those out.
ApoB is a protein found on the surface of atherogenic lipoproteins, which are responsible for arterial plaque formation. ApoB is increasingly being recognized as a biomarker for assessing cardiovascular disease risk. Hemoglobin A1C is a measure of your blood glucose over the past 3 months, which is the average lifespan of a red blood cell. When blood sugar is elevated, it sticks to or irreversibly attaches to the red blood cell, specifically a subset of hemoglobin called hemoglobin A1C. This process is called glycation.
Okay, gang, let me leave you with these closing thoughts. The best way to avoid dementia going into our later years is to make sure that we have the best cognitive and physical reserve possible going into those later years. Now, what does that mean? Let's imagine life like a road trip, and our body and mind is the vehicle. We want to have a full tank because we don't know how long we're going or what twists and turns will lie ahead of us. How do we do that? To fill up our physical tank, we need to make sure we're doing cardiovascular exercise, keeping our heart strong. We need to make sure our muscle health is good, so doing resistance training. Work on our flexibility and mobility so we can get up off the floor easily. Now, what about our cognitive health? That's easy, guys. Always be learning, always be reading, always be watching Ambs Jam, where you get the most premier health educational content. Thank you so much for watching. Please subscribe, that really helps out the channel. Please leave any comments if you have any questions about dementia or any of the other topics that we've discussed or that you'd like me to discuss. I'd be happy to answer them in the comments section below. Please share this video with anyone who is going into their golden years. Try to help them, motivate them to do their best and keep up the good work. Guys, thank you so much for watching. Peace out. We'll see you next time.